Hello. Thank you for clicking on this link. I'm Dan.Pfister, and this is Healthcare Stories, a unique business. When I was young, I started working in the hospital at an entry-level position with environmental services. My first day on the job, a patient had passed away, and I had to transport the body to the hospital's morgue. It was a new experience for me, and over time, I began to understand that I was working in a different kind of a business. Life and death events don't usually happen in the drive-through lane, or a lawyer's office, or a bookstore, or the thousands of other jobs that people go to every day. But a hospital experience always carries some life and death concerns for the patient, and every worker in a hospital, regardless of department, is aware and knows they are working at a different kind of a job. This understanding creates a culture of empathy and shared purpose. This allows the entire organization to quickly focus and assign resources to solve complex problems. That young me coming to work every day knew that I might have to perform that duty at any time. It was a constant reminder of the real-life events that were happening all around the building. Years later, when I was a support technician in an emergency room, about 80 patients would be seen in a 12-hour shift. I was always struck by the variety of problems that would roll in. A baby was delivered in a car right outside the front doors. A shark took a bite out of a surfer. A bus with farm workers overturned. There was no way to predict the mix. Triage is the clinical approach to determine each patient's acuity. But behind the blood pressure cuff, the temperature probe, the team had to be really good at listening, reacting, and decision-making. This skill grows naturally out of the clarity of the mission. Consultants, project managers, process improvement experts all have techniques and methods to drive change. But foundationally, the key ingredient has to be the patient perspective. The coronavirus pandemic of 2020 demonstrated this across the healthcare industry. Entire departments transitioned to a virtual model. Supply chain organizations moved mountains to acquire personal protective equipment anywhere possible. Leaders had to make very difficult decisions to direct the entire patient care delivery network on the crisis. During COVID, I had the opportunity to participate on the supply chain emergency task force for a major health system. The total focus on the pandemic, the alignment of staff across all disciplines to one purpose, the long hours, the efforts, the positive attitudes. It was remarkable, inspiring, and humbling. That experience reminded me, again, what a unique environment hospitals are. None of this will be news to anyone who works in the healthcare industry, but not every department is always on the front lines, seeing the human events that are sometimes very stressful, very sad. Not everyone has the daily experience of the real mission of the hospital. It's possible to go to the office, deal with serious issues, do incredible and important work, certainly, but get caught in department priorities, politics, and become distant. So this is offered as a reminder. Leaders need to bring the core mission, the meaning of the health system, back to their teams whenever they can. Staff will work better, participate, care, the more they are reminded of what is happening in so many places across the enterprise. Tell your staff stories. Stories of the patients, families, community that they are supporting. In everything your teams must accomplish, think about the patient and move backwards from that event. Align everything in the organization to that person on a surgical table, in an ICU bed, coming in code 3 in the ambulance, or quietly going out the back door. Remind your team what their jobs really are.